Ma'am, he's Dr. Vinod Sharma. Okay.
Hi.
Explain
Hi.
better, ma'am.
That's good. You are going to adopt a pet.
Yes,
Excellent.
thinking of it for quite some time now.
Welcome to the pet family. Pretty sure. You have any questions? Like I'm going to have multiple questions with you.
Yeah, that's
Before
what
you
I
adopt because
have no idea because me and my husband have been planning to
Because
adopt a pet basically.
you are going to take a
So-
huge responsibility.
Yeah, mentally
Right.
preparing ourselves. So
Yeah.
just wanted to know what all.
Sure.
Should we go ahead with it or
Okay,
what all
Dr. Alka.
covered?
One more family member. So let's discuss it. Yeah. I'll just explain you everything. You come with me.
Okay.
Yeah. You are like going to be a first time pet parent. So I'll take you on the complete tour of the hospital, how it goes,
Okay.
and like it's more like a human hospital you visit, and people have one, like an idea that how animal hospital looks like. Before adopting, I'm talking at the hospital because it's going to the part of your routine when if you have the pet. She's Dr. Alka. She's a veterinarian. She's like graduated 2 years back,
Oh.
and she will also help you to guide because what's the latest
Yeah,
observations.
because it's
like
my first time,
yeah.
having interaction with a vet. Never, of course, never needed so.
So it's a big responsibility, as I said, you and as a right, like you are inquiring from the day one.
Right.
It's a very good thing to do because everybody can have the pet, but responsible pet ownership is what we miss in India. So responsibility means that you have to have lot of space, good money, and lot of time, and finally love and love and love. And then when it comes to time, what I say generally that pet needs like your own baby. It's a. I always say pet is your partner. So what a partner needs your time. Time for what? Time for interaction, talking, keeping him busy, taking him out, walking, everything. Taking him to the veterinarian for his routine vaccinations, pet nutrition, how to say it, when you go away from, like on holidays, you have to visit some boarding places, so many things, it's not like आपने पेट को अडॉप्ट किया और रख लिया और आप बस पेट ओनर हो गए.
That's what I'm
No.
thinking. It's a lot of things.
And then you have to consider कौन सा breed लेना है.
Right.
Dr. Sir will explain more about breed का कैसे बताएंगे Dr. Sir.
So like you mentioned about the space.
Yeah.
I don't have a very big space. I live in an apartment. नीचे garden है, but it's an apartment basically.
So you need the breed, or you to adopt some dog which is small in size,
Okay.
where you can manage anybody having any allergies in the home, like some
No, we have a parent staying with us, but
parents.
no allergies
Okay.
as such.
Any planning for the babies in the future?
Maybe, but yeah.
So, okay, all right. These are the very basic things, I'm going to ask, because then accordingly we can decide. If you have a small space like a 3-bedroom, 4-bedroom flat, then you don't need a Great Dane or a Saint Bernard or a hairy dog. You should adopt a dog which can go with you, and downstairs and walk and all manage. He can just utilize that space where he can just move around. Because if you have a big dog, it is difficult to manage. And especially high-rise buildings and all that, when you have a huge dog, you have to just take him in the lift. And lift is only for 18 people or 16 people, not more than that. And if he goes with you, he's going to, space is less, and people have problems with them. Small pet you can always carry in the, in your
that
lap
is a
and
plus
move
point.
up and down, not a problem. So a small breed. Now,
Okay.
when I was saying, Doctor, hairy dogs and small hair dogs, you can just talk about
It depends. Like if none of your family member is allergic, and if you can maintain that hairy breed, like because if you will take the hairy breed, I think that will add the more responsibilities in that.
Okay.
You have to groom regularly. You have to brush that pet regularly. So there are a lot of things like the regular bath. Everything will
Okay.
get increased with that thing.
Okay.
So
Yeah.
you have to prepare your mind accordingly. If you are okay with all those things, you can choose accordingly. And if you are
Okay.
not okay, then you have to choose.
and
short
think
hair
again.
breeds. Yeah.
Okay.
Think
so
again,
some
then-
a breed with a short hair probably
Yeah.
or.
So we can suggest you that something will help you out definitely on that. That when you are just prepared after this our conversation and
Yeah, I
interaction.
think over.
And then what was pet needs a regular vaccination. So visit to veterinarian will be regular to you. Visit to for the nutrition, because many times we think जो हमारा घर का खाना है उसी को खिला दो, ऐसा
Correct,
नहीं
yeah.
होता है. In that condition, you have to take couple of nutrition
Okay.
consultations.
Okay.
उनको डिवॉर्मिंग की भी जरूरत होती है. आई थिंक तो हम लोग ह्यूमंस कभी कभी डिवॉर्मिंग भूल जाते हैं,
Right.
बट वेटेरियंस आपको बार बार याद दिलाएगा कि भाई वो डिवॉर्मिंग भी के लिए भी
अच्छा,
आना है,
okay.
वैक्सीनेशन के लिए भी
Yeah.
आना है. और एक और चीज़, आप वैक्सीनेशन करते हैं, अपना बेबीज़ का कार्ड रखते हैं, अपना कार्ड रखते हैं हम लोग, बट डॉग्स में या कैट्स में जब अडॉप्ट करते हैं तो वी हैव टू हैव प्रॉपर एंटी रेबीज सर्टिफिकेशन, एंड बिकॉज यू
Okay.
नीड टू रजिस्टर विद your corporation or
Right.
yeah.
So I think all the reminders you'll
Yes.
send the hospital. Okay, yeah, because
And
it's difficult to
secondly,
remember.
yeah, it's like आपको सुबह उसको घुमाना है, उठाना है, ले जाना. एवरी यू हैव टू जस्ट प्लान कि आपके पास क्या ऑफिस जाते हैं आप,
हाँ जी.
यू आर वर्किंग,
Yes.
सो वर्किंग में पीछे कौन रहेगा, हु विल लुक आफ्टर. इफ यू जस्ट पेरेंट्स आर ओल्ड एंड वी जस्ट लीव हिम एट होम, वो बेचारे कैसे घुमाएंगे, राइट. वी हैव टू रिकंसिडर एवरीथिंग इन माइंड,
Right.
राइट. उसके बाद आप शाम को ऑफिस से आते हैं, कभी कभी आजकल आपने सुना होगा बहुत कुछ होता है, लिफ्ट में किसी को काट लिया, किसी ने घर में किसी को काट लिया, कोई जंप कर रहा है.
Right.
I don't want that to happen, because why it happens, because we are not giving enough time to the, and we are not really talking about the behavior of the pet there. So वो जब behavior की बात करते हैं तो लोगों के दिमाग में concept है training is not the right word to be used. It is all about behavior. We are not training for like your disaster management, or we are not training for any searching. We are only talking, he's a companion, he's a partner in the family, so we have to talk about the behavior, not training. उसके लिए भी आपको मतलब you have to spend some time and help, the pet and the pet parenting together. So it is, we use pet parenting. So what a parent responsibility is,
Okay.
that is missing in Indians, or maybe not, I will not say Indian, everywhere. So I think you are a right candidate to have a pet when you have so many
Yeah.
queries and you are thinking. And plus we always forget one thing, भाई हमने तो डॉग ले लिया, लेकिन व्हाट अबाउट माय नेबर्स,
Right. हाँ.
क्योंकि सबसे पहला कंप्लेंट तो दे आर गोइंग टू डू इफ दे आर नॉट पेट फ्रेंडली,
Right.
or they
Like
don't
in
like
my
pet.
apartment, no one has. I mean.
Yeah, or you are away from home and the
Yeah.
pet is barking, somebody who is sick at home, or they don't
They
like.
might have.
So
Yeah.
you talk to the neighbors also that
Okay.
I am planning, because it's a healthy relationship in society.
Okay.
If we have good neighbors, I think so we are gifted.
Of course.
Same way, if your pet walks outside
Yeah.
and the neighbor comes in, he will love him and the pet will love him. And if they hate each other, then
yeah,
secures,
Of course.
right? So do consider their,
Yeah.
like.
But do you think whenever, like, if we get a pet, is it okay for the society, kids and everyone to play with the pet or touch him?
That's a very good question. Like I talked about behavior. If your pet is well behaved, he can. If he's fully vaccinated, he can. He's fully dewormed, he can.
Okay.
So, but again, interaction of a pup and the kids, because both are like, like in the stage
Like
where they
kids,
want
yeah.
growing and things,
That
they have no
curiosity,
idea how to interact, they just jump and cuddle him, he might not
Yes,
like it.
yeah.
So whenever you just go and talk to them, they definitely tell them, okay, his name is this, introduce him.
Okay.
Introduce him.
Okay.
If you don't introduce, they will just say, "Arey, ye puppy hai, bahut acha hai puppy." No, they just
because
want
that's the
to
natural
just handle. Let
reaction,
them
yeah.
tell that how to handle, how to just take
Okay.
care of it. उनको walk कैसे करना है, how to touch him. They generally just go. They put hands straight to the eyes and all that. It should not be. Or somebody is going to pluck the hairs, or pull the tail. No,
Yeah, that is of course not.
that's not. Like, so they just remember everything. And in future, if it is happening in the system, I'm pretty sure that they don't like it.
Exactly.
Yeah.
Exactly.
And it how it goes, वो वहाँ से उसने किया, अब वो पेट और वेट दोनों जब इंटरेक्ट करेंगे, जैसे ही हम उसका टेम्परेचर चेक करने के लिए टेल को टच करेंगे, he might scream because he doesn't like
He
it.
doesn't
He will
like
remember it कि मेरे साथ फिर
Right,
कुछ होने वाला है.
right.
So हर चीज़ को कंसिडर करते हुए we have to think whether, and then time. Lastly, टाइम कितना होता है कि आप वेट के पास आपको हो सकता है कि टाइम लगे, वेटिंग टाइम लगे, आपको गाड़ी लेके आना पड़े, इमरजेंसी में कहीं जाना पड़े, so to prepare your thing that आपके पास टाइम होना चाहिए उसको डॉक्टर के पास ले जाने तक का. आपके यू कांट से कि भाई आज मेरे पास टाइम नहीं है, नो, बट timely vaccination, timely deworming. If he's sick, you have to spend some time. हो सकता है ऑफिस से छुट्टी भी लेनी पड़े. But there are good hospitals and good places now where you can leave them in daycare. वो आराम से आप जा सकते हैं. If you have, you know, like even when your routine he's healthy, you can just leave them as a daycare and go to the office, and in the evening you can pick him up.
So you guys have like a boarding place?
Yes, we do have. We have in one of our facility. We have the you know, like daycare.
Okay.
So that responsibility we can take.
Okay.
Right, but
I might have to, you know, just go and visit the place and
yes, and
because obviously never visited, so I
and
don't
then
know
what
how
happens,
it looks like.
बहुत सी चीज़ें होती हैं, you know, like you plan. चलो मेरे को नहलाना है, मैं खुद ही नहला देती हूँ, बट उनके शैम्पूज और अपने शैम्पूज बिकॉज उनका स्किन का पूरा डिफरेंट है टेक्सचर, हम लोगों का डिफरेंट है. वी स्वेट, दे डोंट स्वेट. उनके कान भी कुछ कान साफ करने हैं, उनके दांत की हाइजीन भी जरूरी है. एवरीथिंग अदर इट टीचेज यू दैट यू हैव टू बी रिस्पॉन्सिबल एंड यू टू बी मोर हाइजीनिक एंड मोर एवरीथिंग. वो साथ रहने में तो बहुत कुछ अच्छा हो जाता है. तो आई थिंक यू आर इफ यू आर प्लानिंग दिस वे इट्स गुड. और क्वेश्चंस आपके कुछ हैं तो यू कैन आस्क मी.
Of course, vaccinations जैसे आपने mention किया, उसके अलावा मतलब how often a pet needs to visit a hospital या vet, मतलब vet के पास vaccinations भी कितने duration के बीच में होते हैं?
Vaccinations का मतलब once we start with as a puppy, then we have to do the boosters. The whole cycle gets completed almost in 4 months.
Okay.
Right, and then annual vaccination is needed.
अच्छा.
And deworming is like.
Exactly. Deworming, like once your pet will reach at the age of 6 months, after that we have to repeat every 3 months. Till the end.
Okay.
So, and up to 6 months, there's the different schedule that is much more frequent than that 3 months. So that your vet will explain you like I
Okay, understood.
So basically, you have to take care the full responsibility as like the kid.
Right. That's what I'm trying to, because obviously every time visiting the vet and
More than it.
yeah, because I see so many products online which obviously look very cute, but then of course everything comes with a cost. So yeah,
And
they have so many accessories and everything.
And then you have
so
to search more, like as I told you, when you are away on the some emergency comes or some function is their family. So you have to find a place where we can just, as I said, we do the daycare, we do the boarding also.
okay, so for the night also, like they can stay.
They can stay, and then you can, because when you, it's not that you just come to me only for that. When you are going to any other city also, or you just, you know, like if you have a system that you want to stay in A city or B city or third city, find out a boarding place which is pet friendly.
Okay.
Right? It's like it's a good homework, you know. Like when we go, we just find a school, good school for
Right.
things. Same way you provide a good pet boarding facility, a good vet out there, anything. So it's not that कि हमने डॉग रख लिया और उसको बस बांध के रख दिया. नहीं, no chain. It needs loves, you know. जब उसको responsibility लेके आए, he trusts you. Where he is going to distrust because you are everything for them.
Correct. Yeah.
Right? So if you feel that you qualify for all these things, I am sure that you will go.
A lot
if
of
no,
thinking
then you can
required.
still plan,
Yeah.
right? And good luck.
Yes.
And we
you
are
so
there
much.
for you anytime. You can just
Yeah, it
use
was
our
like
facility.
huge help because there are a lot of things, a lot of terms which I had never heard of. So yeah, I think I might
But
disturb you again. Just
No,
visiting
I'll
the
just
place
take you
again,
around. I'll show
get my
you what
family, and you know,
vet-
just get more
Vet
comfortable.
hospital looks like, you know. I'll
Yeah.
take you around.
Sure.
You know, Talka, I think so. You come with me?
Yeah, sure.
Explain now. So you can bring in your, you know, the examination room.
Okay,
Any
okay.
kind. Examination room is here, right?
Okay.
And this is like, this is like different consultation rooms. We have 3 rooms here.
Okay.
And then we have a treatment hall. And this is our operation theatre. She Dr. Niharika, which is coming out of the surgery right now. And these are my vet. She's our, you know, like front office. She's just coordinating, you know, the patients and the doctors' conversation. So that's the, you know, dog and after surgery the recovery room and house patients. This is our surgery. I don't want to go in, but you know, you just finish the surgery.
Okay.
This is our lab where we do, I don't know whether first time,
First time,
we do
of course,
all the
yeah.
blood test, you know, like
Okay.
what we do for, you know, CBC or liver function test, kidney function test, and couple of more, huge list
Okay.
of tests we need to consider because it needs diagnosis.
Right,
And
right.
the same diagnosis we have the facility for the ultrasounds. We do ultrasound for dogs and cats, pets, and the same is X-ray. So
Pretty much like
they are-
human hospital,
Exactly,
all the
yeah.
facilities
So-
are there. Yeah, it's well
So that's why
equipped
it's
and
a pet
everything.
means it's a family member.
It's a family member, yeah, of
It's,
course.
and we as a DCC, we always say that they're equal to us. We have to give the same respect and care to them and love what they deserve.
Of course, yeah.
Thank you.
Thank you
Please
so
be
much.
welcome.
Thank you so much.